Hello, my dear FMG friends. This is Dr. Rajiv Dhawan, your ENT faculty with Doctor Tutorials. And I'm extremely happy to have Dr. Pawan from Maharashtra with me. And Pawan has successfully qualified in the FMG examination of January 2023. And we are very proud of his success. And Pawan is here to share his success story with all of you so that you are able to, use certain tips from his side to make sure that you're also giving the interview the next time when the exam is over. So Pawan, welcome to the session and thank you very much for joining us.
Thank you so much, sir. Thank you so much. I'm glad to see you, sir.
Definitely. Same, Pawan. Pawan, which university did you graduate from?
So I did my graduation from AMA School of Medicine, AMS School of Medicine from Philippines.
Philippines, Manila. Great. And this was your first attempt, as you told. Yeah. And the score, please share the score and we will be delighted to hear the number.
Yes, sir. I got 224, sir, out of 300 in very first attempt, sir.
Wonderful. 224 in first attempt is a wonderful score. And FMGs are continuously proving that, that time is not far away when, this distinction between the IMG and the FMG, would actually disappear and we will all become medical graduates, maybe, from India or internationally trained medical doctors. That's all actually it will be. But now, anyway, these kind of success stories are actually stimulation for the future generations to make sure that they do not feel that being trained from outside the country does not convey that your training is, your education is little lesser than Indian medical graduates. It's at par and it's getting better and better. And we are very delighted to have this kind of numbers and results this session. Pawan, how was your experience of learning with Doctor Tutorials?
Sir, actually, I started my preparation from second year, sir, second sem. I was using this Doctor Tutor lab, sir. So along with my college exam, sir, I was preparing for the Doctor Tutorials, sir. Like suppose for example, I have exam on myocardial infarction next week. So I used to learn this topic from the my Doctor Tutorials, sir. So same thing, at the same time, sir, I was preparing for the FMG also for my exam also, college.
Wonderful. So we are glad that you started using it early. My dear friends, Pawan has a message for all the juniors that he started using the resource very early in his, MBBS, college time only. So guys, and this is a very, all interviews of this kind of, topic, when we interact with the people who have made it, is basically, to convey to the juniors that what they should adapt from their success stories, that they can also succeed very easily. So one tip Pawan is sharing with us is start early and use the resource also early. And because, your understanding start getting better, Pawan. I think
Yes,
you would agree with that. Yeah, Pawan.
Yes, sir.
Pawan, Pawan, how much importance do you give to solving multiple choice questions for the preparation of the FMG examination?
Actually, sir, that is the basic steps. If you want to score a good score in exam, sir, that is the basic step. You have to solve at least 50 to 100 MCQ daily practice, sir.
Wonderful. 50 to 100 MCQ every day. Yes, absolutely. A reasonable target, a doable target, and a wonderful, way to retrospectively revise your notes also. Yeah. And yeah, sure. Sorry, you're saying something.
Yeah, that's the way, sir, you can catch the important point from the MCQ, sir.
Wonderful. And Pawan, did you do the previous year questions as well?
Yes, sir, in the last 2 months, sir, before the exam.
Wonderful. So previous year questions are mandatory, guys, and you must have seen this time also paper 1 had a lot of repeats. So that actually, bridges the gap between, what you want to score, and sometimes difficulty level of the paper 2, people say it was higher, but people who had done the previous year question, they already knew what kind of question expected in the, at least paper 1 was having, and it's a changing pattern. Last time paper 1 was little challenging, this time paper 2 was little challenging. And Pawan, how was your journey with the clinical subjects? How did you prepare, like medicine, surgery, OBGY? Were you confident about them? Was the paper difficult for these subjects? What was your impression?
Sir, actually, the paper 2 is not much difficult for me, sir, because I was good in the clinical subjects, sir, like medicine, OB/GYN, surgery. I was good in that, sir. So when I was outside the part 2, sir, when I came out after solving part 2, sir, I was very confident that I will get at least 100 plus, sir. That.
Wonderful. So, guys, let me share. There's a very important thing. Actually, I've been interacting with a lot of FMG pass out of this session, and first impression of the paper on 20th January was paper 2 was very difficult. But as days passed by, people started understanding paper 2 was not that difficult. The language was little twisted for sure for the questions, but topics were almost like doable. So that was the impression, and a lot of students who have scored 200 and above. In fact, they are saying the paper 2 was even better than paper 1. Somehow, I'm getting this impression now that we also learn with you guys actually, because in the first part, 20th January evening, we got this message. It's very tough paper 2. But as now results are coming, before result also, a lot of people said that, and this is a very good sign. This is a very good sign. Clinical specialty becoming stronger. With the FMG student would definitely change the game, and it has definitely changed the game this time. Medicine, surgery, OBGY becoming stronger would, that's why so many people scored 200 plus this time. I've never seen so many 200 plus students because this is my 25th FMG examination. Actually, this was actually. So I've never seen so many people passing and so many people scoring 200 above, and this is a very good sign. And all dear juniors, have this confidence. If your seniors could do it this way, we'll do even bigger, even brighter, and even more score will be there for sure. Pawan, how did, I would say that, when your final leg of preparation was going on for the FMG, after you came back from university to India, how did doctoral contributed to your final leg of preparation?
Sir, I can give, sir, my 80% of the credit of the skill score to doctoral, sir.
Wonderful. Thank you very much for that appreciation. All our faculty members are doing a lot of hard work to, make sure the content is actually relevant for the exam.
Absolutely, sir.
Which all subjects did you revise from the app in the later part?
So in the last days of the exam, sir, I used to revise the volatile subject like PSM, sir, biochemistry. These are subjects that I can forget, sir. I used to forget this subject, so I revised these subjects from the doctoral, sir.
Okay, wonderful. Any points like when you felt low and demotivated, and how did you bounce back?
So in everyone's life, sir, ups and downs come, sir. And that's not the only thing that comes to me, sir. So I used to study. I used to stick to my syllabus, sir, the schedule. Yes, sir.
Wonderful. And any message for juniors you have while you share your journey? What tips would you give? What suggestion would you give to them so that they also succeed in the first go as you did?
Sir, my only suggestion is to focus on building your concepts, sir, in medicine. Sir, these are the all subjects, sir. You should focus on developing the concepts, not just mug up.
Very good. So developing concept is getting more and more important, guys. All FMG students, you should understand this thing that if you're conceptually clear about the topic, and even if the topic is twisted in the statement of the multiple choice question, you would not actually get deviated from that. So that is what. So take home message for me, if I'm FMG, from Pawan's words are: start early, get conceptual, do a lot of multiple choice question, definitely do the previous year questions also, and make your clinical subjects stronger. These are 5 important points. Okay. Pawan, do you have any message to convey to our faculties as you are celebrating your success? The final words from your side.
Sir, I would like to thanks to all the faculty, sir, who helped me getting this course, sir. Yes, sir.
Wonderful. Thank you very much. And we wish you a wonderful career as a medical professional in the country. Every faculty of doctorals, every team member wishes that Pawan and all the FMGs who passed the examination should take this journey forward. And, we would interact again. We will learn together again for the NEET PG or the next examination to make sure that, you become specialized doctors of this country and practice in your area in a wonderful manner.
Thank you so much, sir.
Thank you, Pawan, and best wishes from our side. Thanks a lot.
Thank you.